There are millions of women like you in Africa. For many women, contraception allows them to plan when to have babies. Using contraception is a safe and healthy choice. With correct family planning, you can avoid unwanted pregnancy and wait until you are ready to get pregnant. Having a baby at the right time, when you are ready and healthy, is your choice. Now, there is a long-acting contraception method available for you. This book is here to explain the single rod implant to you. The single rod implant is an innovative contraception method. It can be hard to remember to take pills every day or difficult for you to get to the clinic. This single rod implant works for 3 years. The single rod implant is a small stick that is put into your arm at the clinic. This implant is used so you can prevent pregnancy. While using the single rod implant, the chance of becoming pregnant is very low. You do not have to remember to take or use contraception. It can be taken out at any time when you decide to have a baby. After removal, you can get pregnant soon. If you decide you would like to use the single rod implant, the health worker will ask you questions about your health, what medicines you are on, and if you have been sick. Most women can have this implant, but it is important that you answer all the questions as best as you can. Always tell your health worker if you are on any antibiotics or if you have TB, epilepsy, or HIV or AIDS. This is because treatment for these illnesses can stop your contraceptive working properly. It is important to tell the health worker all the medicines you are taking. However, if you get sick with a cold, have diarrhea, or are vomiting, your implant will still work. Remember to tell the health worker that you are using the single rod implant if you are given any new medicines. It is important to know that the single rod implant does not give you or your partner protection from any sexually transmitted diseases. You may still need to use a condom to protect you from HIV or other STDs. You must not use the single rod implant when you are pregnant. If you are not sure whether you are pregnant, you should have a pregnancy test before you have the implant. If you are breastfeeding, the single rod implant is suitable for you and will prevent you becoming pregnant while you have your baby to care for. Your health worker will let you know when it is the right time to insert the single rod implant. The single rod implant should be inserted between 21 and 28 days after delivery. If the implant is inserted late, then you and your partner should use a condom for the first 7 days after insertion. The single rod implant is the size of a small hair clip. A doctor or nurse will give you a medicine so you will not feel any pain in your upper arm. They will then put the single rod implant under your skin on the inside of your upper arm. It will only take a few minutes. There are many advantages of the single rod implant. It works for 3 years. You don't have to worry about forgetting to take your contraception or not being able to get your contraception. You can use it if you are breastfeeding. If you decide to have a baby, you can have the implant taken out, and it is possible to become pregnant soon after. It can also help stop heavy or painful periods. Your periods might change when you have the single rod implant. You may have longer or shorter bleeding during your periods or have no bleeding at all. The time between your periods may change. Sometimes during your periods you may have a little bleeding or spotting. These changes are not harmful. If you are worried, speak to the health worker. Like with any medication, there could be some side effects when you first start using the single rod implant. You may have a headache, your breasts may be a little bit sore, and you may feel moody. This will go away in a few weeks, but if you are worried, speak to the healthcare worker. Your health worker will tell you what to expect before you agree to use the single rod implant. After the implant has been put in, the health worker will check to make sure it is in the right place. The health worker will show you how to feel the implant so you can check it yourself. Your arm may be a bit sore for 1 or 2 days. This is normal. The health worker will put on a plaster to keep it dry and clean, and you can do all the things you wanted to do. Your health is your responsibility, and it is important that you look after it. Always see a health worker if you have these problems. Your legs are swollen, you have chest pain, you are coughing a lot, you feel a lump in your breast, or have sudden pain in your stomach. Always tell the health worker honestly how you feel. Family planning is important for your health and your children's. You have the right to use contraception and to choose the right one for you. The single rod implant works for 3 years. It can be taken out before this if you choose. A health worker who is trained in implants must take it out. The health worker will feel your arm to find the implant like you have been shown how to do. You will then be given medicine so you do not feel anything during the removal of the implant. Then the health worker will make a small cut and take the implant out. If you are not ready to have another baby after 3 years of the implant use, you can ask your health worker to insert another implant immediately in the same place as the previous implant.